today in conversation with Dr. Preeti Tandon from Fakir University Hospital. There are so many minimal invasive surgeries these days which are much easier than the before. So let's find out from her a lot more about it. Hello, doctor.
Hello. Thank you for having me.
Of course, doctor. Doctor, we want to know what are these minimal invasive surgeries and how are they different from the olden days surgeries?
Well, minimal invasive in the name itself means that there is less invasive way the surgery is performed compared to the older conventional way where patient would suffer a big cut and take longer time to recover.
Yes.
So this is done through the minimal invasive route, which could be laparoscopic, hysteroscopic, or through the robotic way.
Okay. And are they less painful? How are they performed?
Oh yes, definitely. The surgery, say if it's a laparoscopic surgery, small tiny incisions are made on the patient's abdomen.
Okay.
The abdomen is inflated with some gas so that we get some space to move around and to have a proper view inside.
Okay.
And through the camera, the laparoscope which is inserted, we get a view on the monitor. Look
Okay.
at that and then the surgery is performed.
Okay, so the process is also quicker?
The process is time taking.
Okay.
A little bit more than the conventional surgery.
Okay.
And but it translates into patient benefits manyfold.
So maybe the recovery is
yes,
quicker?
definitely. The recovery is
Okay.
much faster. The patient hospitalization is much lesser. Patient experiences very less pain. So much less medication is required. The blood loss is also lesser.
So there are more advantages
Oh yes, definitely.
to these kind of surgeries. Are there different, you mentioned that there are different types of surgeries when it comes to minimal invasive. And so for each different disease or a condition, different type of surgery is required?
Yes, like in
Okay.
gynecology, we can diagnose and treat various problems or patient conditions laparoscopically or the minimal invasive way.
Okay.
We can treat fibroids, we can treat endometriosis, ectopic pregnancies can be treated laparoscopically, ovarian cysts can be tackled laparoscopically, even cancers can be tackled laparoscopically.
Okay.
So there are various things which can be treated, and only if one is aware, one can have an access to these kinds of surgeries.
Okay. So most of these surgeries that you mentioned are way more less painful than what women had to go through like
Yes.
few years before.
Than the conventional way, this
Yeah.
is much less painful.
Okay.
And of course, as I said, the patients can resume their activity faster. They're back to work much sooner than the open way.
So now that you mention it's like less pain and faster recovery, tell me what all types of surgeries can be covered under this?
We can do surgeries hysteroscopically to remove fibroids, to remove any polyps. Women face a lot of bleeding problems.
Yes.
So those can be diagnosed and treated through a hysteroscope, where there is no cut, no incision on the abdomen also.
Okay.
They're hospitalized in the morning, they undergo small, short duration anesthesia, the procedure is done, and same day evening patient can go home.
Okay.
Patients who are not able to get pregnant, who are facing infertility issues, they can undergo hysteroscopy, laparoscopy to diagnose and to treat the problems at the same time.
Okay.
Where there are big fibroids, myomas, as we understand, the tumors of the uterus, those big fibroids can be removed the minimal
Sure.
invasive way as
Yeah.
well. And if there is endometriosis, it's a condition which gives women a lot of pain. They have some bleeding problems. They can have a lot of they can face difficulty in getting pregnant also because of endometriosis. So we can, and laparoscopy has been marked as gold standard to diagnose and treat endometriosis.
Yeah, and what I'm understanding is that there are a lot of day-to-day daily conditions, the suffering of a woman which can be also tackled with these surgeries and which are, as you said, minimal invasive and no pain and faster recovery. Then I think women should try to know a lot more about these
Yes.
options available. And I'm very happy that Fakir University has so many options available now. Thank you, doctor, so much. I think you've answered a lot of our queries, and this is now on to all the women that you must make an extra effort to know more about your health and technology that are available for your better health. And Fakir University Hospital is one of the best options that you can come and consult doctor and know a lot more about your health. Thank you, doctor.
Thank you so much.
Thank you.